Lagos, it is 16 minutes, gone past 5, and you are tuned into Smooth Health on Smooth 98.1. And as always, on Smooth Health, we talk about everything health related and how best you can take care of your health. And today it's not going to be any different. I know usually they say June is all about men, and we'll talk about men's health. But yeah, June just left. We're still, technically we're in July, but yeah, we can still squeeze in one more conversation about the men. And today we're talking about men's sexual health. All those myths, all those interesting things that you've been hearing. How true are they? Well, we'll definitely talk about the libido. We'll talk about testosterone. And, well, I will leave the other conversation for the doctor. He's going to be telling us if those myths you hear, how often is it true that 21 times a no? Is it a month? It's the amount of time you should be engaging in some extracurricular activities. Well, as always, glad to have my favorite person. Well, virtually, by the way. Yeah, someday he'll come into the studio, but for now, I'm happy to have him virtual anyways. Good evening, Dr. Abiola Ajayi.
Good evening. Thanks for having me.
Glad to have you here. Lagos, I know that the men are listening and you will definitely have a question or two you want to ask. Well, don't be shy. You can ask your questions. And indeed, it's going to be an interesting conversation. All right. I have a ton of questions I want to
All
get
right.
into. But when it comes
This is
to
this is
men,
this is a good topic. This is something I deal with every day, almost every day. So it's a for urology. This is a fantastic and it affects almost everybody. So it's very useful.
okay. So, like I said, it's not just the men that are, involved in this. Women too. You also need to be here so you can help your partners. Sometimes the men get shy when it comes to conversations like this, but it is important to have them nonetheless. And thankfully, Dr. Abiola Ajayi is here to, shed more light on that. But let's even start off with testosterone. What exactly is it, and why is it even important for the men?
Yeah, testosterone is the main male sex hormone. So it's what makes men, right? So it's produced mainly in the testicles, and it plays a big role in developing male characteristics like muscle mass, deeper voice, facial and body hair. It's
Mm,
that's his main function, but it's more than just the manliness hormone. It's also
okay.
responsible for things like sperm production, sex drive, energy
Okay.
levels, and even your red blood cell production and mood regulation. So in men, testosterone levels they peak somewhere around 78, 17, 18, and in the early 20s, or the early 20s, and then by 30, it starts declining. So you lose about 1% a year from age 30. And then by age 40, it's a little bit faster, and age 50 is a little bit faster. I like statistics. In the
Yeah,
state,
it actually
in the
helps.
in the States, about 20% of men over the age of 60 have low testosterone, and nearly 50% of the men over 80 will have low testosterone. And in
Okay.
Nigeria, many men over the age of 40 experience symptoms linked to low testosterone. But like you said earlier, well, men may be too shy or too proud to get tested or talk about it. Yeah, but it's a very very common problem, and I'm seeing a lot of it when I see it in my practice. I'm either seeing people having difficulty maintaining erections, or
Right.
no interest in sex, or just fatigue, or difficulty getting the wife pregnant. Oftentimes, it's due to falling testosterone.
Mm. But what could even be the signs? Because maybe they need a sign to realize that something is wrong. Are there any symptoms they should be looking out
Yeah,
for?
there are a bunch of signs, and the problem with I'll go over them, but the problem with the signs are a lot of men will attribute, oh, I'm just getting older, or I'm just,
It's
stressed.
just
But
that.
really, really, I told a 75-year-old man that had erectile dysfunction yesterday. I said, you, if you want to have sex at age 75, you should be able to. We can fix that. He said, really? I said, yeah. I say, yes. It doesn't mean you have to give it up when it goes. There's things you can do. So
Yeah.
some of the signs of low testosterone be reduced sex drive or reduced libido, fatigue, erectile dysfunction, loss of muscle mass, weight gain, especially around the belly, we call that centripetal obesity, and low mood. Some men may also see the beard getting thinner, difficulty concentrating, and even your bones get weaker. But the thing that's important to know is that these things creep in gradually. Remember, I said that from age 30, it dropped by
Right.
1% a year. So a lot of people just think I'm stressed, I'm getting older, but in many cases, it's low testosterone. That's the problem, and it's often misdiagnosed. And you remember I said testosterone helps with your mood. So oftentimes these
Right.
men will have depression or anxiety before we now find out that low testosterone was their issue. In in Nigeria, here I see men in 40 and 50s. Those are the main complaints. They're vague, but they usually say low energy, reduced sexual performance. Um, those are the things I see most often.
I already have some questions being shared with me. We'll get into that. We'll get into that. Just give us time to, get into the conversation itself. I promise I'll come back to your questions. And when it comes to you just highlighted how things can actually affect testosterone and sexual drive. How how can they back because you said stress, poor sleep, eating back I've actually seen that one. And then you start seeing them with huge pot bellies, and you're wondering, okay, um, how is this supposed to help our situation? So how do all these also contribute to testosterone failing or being poor that it also affects the sexual activities?
I'm not sure I got your question exactly.
So how do all these factors affect the sexual health of the man who's,
Okay,
because
okay.
naturally, hey, he's expecting that I'm eating good. It's stress that's it's just things that are happening. Some have also resulted because I've seen some reports that some have decided, okay, since this is the situation I'm going through, I could just hit the gym, but it's still not working. And they're
We'll,
wondering,
we'll, we'll, we'll talk about how exercise affects this, but I understand your question now. Chronic, something like chronic stress. Chronic stress increases the stress hormone called cortisol, and
okay.
cortisol suppresses testosterone production. That's chronic stress. Poor sleep does the exact same thing because most of your testosterone is produced at night,
Mm,
especially during deep sleep. And if you deprive yourself of sleep for a week, you can drop your testosterone levels by 15% if you have
right.
poor sleep for just 1 week. So it's those two factors are extremely important. Diet is very important. Poor diet, meaning processed foods, too much sugar, too much alcohol, fried
Oh,
meals. These
okay.
all contribute to low testosterone as well as weight gain and clogged blood vessels. And we have to remember that erections is blood flow. It's not a bone that's there; it's the flow of blood in there. So if you have a poor diet, high cholesterol, diabetes, hypertension, you can often damage those vessels and have erectile dysfunction as well as low testosterone. In Nigeria, a lot of men that are working, they come home late. They eat heavy
Oh,
late
yes.
meals.
Heavy
Yeah,
late
chase it,
meals.
chase it down with some alcohol,
Ooh.
and sleep poorly with the phone screen or something. All of these things add up, and over 70% of adult men have some of these issues. 70% of adult men that are overweight and obese will have these issues of low testosterone and sexual dysfunction or poor sexual performance. So your lifestyle choices directly impact your hormone control and your performance. If you can clean up these habits, your sexual health can improve naturally even. And if I now what I've been doing lately for patients, whether it's infertility or I now do diet, nutrition, and lifestyle guides customized
Mm,
per patient. And the ones
right.
that actually pay attention to it see big changes besides just using
Okay.
medication.
Now that brings me to the major question I want to I want to get into this one way early. I know that I've heard where I'm sorry I'm laughing about this one, but it's something I've heard even younger adult male get into, and it's just amazing that they think that they need to take pills to boost performance, or they need some enhancements that are being sold. Oh, you there's so many. My major question is, do these things actually work, or is it just a covering to the real issue? Or
There,
is this a placebo effect? Because sometimes they take these things and it seems as if, huh, okay, it seems to be working. But is it really working?
There, there's some, let's call them performance pills.
Okay.
I won't name the names of them online,
Ah,
but there's the blue one and the yellow
oh
one,
yes,
right?
you know
So
those blue ones.
they 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 do help. They help improve blood flow to the penis, and they make it easier to not only get but sustain an erection. But
Okay.
they usually only work temporarily. Like the next time next time you want to have sex, you may have to use it again. One of the things about
Right.
integrative medicine, which is what I'm practicing now, is that you need to try and find the underlying problem. Sometimes these
Right.
men are having erectile dysfunction because of poorly treated diabetes. If you or poorly treated high blood
Oh,
pressure. So if you
right.
correct that, you can now correct the erections without having to just use pills all the time.
Oh.
If a man has low testosterone,
Mhm.
diabetes, high blood pressure, or he's under chronic stress,
Mhm.
the pill these particular pills may help performance for a night, but it's not healing the real issue, you know? So the problem in Nigeria is that many men can buy pills,
Off
performance
of
pills
the, oh
without a
yes.
prescription, and
Mm-hmm.
sometimes from unreliable sources. Some of these can contain unsafe ingredients, or the ingredient on the bottle is not really what's in there. So
Oh,
um, I can say, yeah, pills can help, but you need to have a medical professional prescribe them for you because they need to take into account so many other things. A lot of those pills can give you very low blood pressure, can cause you to have heart problems,
right.
can cause you to have headaches. So you really need to work with your doctor to find not only your right dose but the right medication for you.
You know what? We're going to take a quick breather. I already see more questions coming in. And Lagos, when we get back in, we'll talk about all the things you want to, what could boost your testosterone, what supplements, if there are any that you need to be, taking, or if it's just your regular meals that you need to, change up on. But let's take this quick breather. On the other side, we'll definitely will continue here on Smooth Health and Smooth 98.1. On the drive. As always, just a
You
minute,
do
we're back in.
commercial? No problem. I like it.
Amount of questions I'm already seeing. So
Really? Coming in on social or on WhatsApp?
on WhatsApp, actually,
Oh,
it's amazing.
I love questions. So
Oh yes,
anytime.
and that's the one I willing to put out there is this myth regarding having to ejaculate. How true is that? Well, I'll ask that when we get back in, but really, whoever came up with those thoughts and said it was normal,
Is
someone.
there was a study done. There was a study done, and I'll tell you about it when you ask me.
All right. Yes, Lagos, 31 minutes, gone past five. We're tuned into Smooth Health here on Smooth 98.1. And yes, we're talking about men's health today, men's sexual health to be precise. All the testosterone that you need, is your libido active? How good should it be? And all those interesting myths that you've also had at some point in time. You've been wondering if the things you see online are true or if they're just people trying to sell things. With that, I think I shall pause on my. Yeah, I have a few more questions I'd like to ask the doctor, but some of them are intertwined with what you're definitely asking. Charles Chidozie, you are definitely a troublemaker. Well, Charles says that he's seen a post online
You seen
where
what?
he saw a post online that
Okay.
suggests that the he says apart from the usefulness and productivity of the testicles, how true is it that in the stock market, I don't know what stock market he's talking about, that it is worth a hefty sum.
It's worth a what?
A hefty sum.
What is worth?
From his calculation, he says it's worth 600 million, and I don't believe this
What are
thing.
we talking about?
Testes,
Oh,
testicles. Even you,
so
even you were wondering, like, where did this come from?
where does this come from? To
These
be
are the
honest,
things I'm talking about, the myths that people
I,
just
I,
put
I,
out there and they run with it.
I don't engage in the buying and selling of organs or body parts. I'm a surgeon, so I do remove testicles all the time, but I don't sell them. I give them back to the owner, and if they don't want them, we dispose of them. But
Medically,
there's
yeah.
some cultures, especially Asian cultures, that revere eating testicles, whether it's the testicles of humans
Oh,
or
bulls. I've
of
heard of
different
bulls.
bulls and different animals. So yeah, there's something to it. I don't know about 600 million, but there's something to that. Even some steroids used to be made from extracted from bull testicle. They would take testosterone from there and try and make it. But now we have many forms of synthetic testosterone that work much better.
All right. So Charles
So
Peter says, don't believe everything
keep
you
your
see.
testicles. Don't go and sell them for any amount of money.
Please. All right. Now let's get into more interesting questions that are actually worthy of having your thoughts on. So here's one that you've also been talking about. I think you said you've been doing some research on that, and that has to do with herbs on and how it affects sexual activities. So people buy off of this is a question that was sending anonymously, and he says no, he doesn't want his name mentioned, so it's fine. So he says, "What's the effect of herbs on sexual activities, especially the ones you buy off of just random people that are selling them? It's not necessarily the quote unquote agbo, but also, they're selling herbs and telling you, oh, if you take so and so, mix this together, biscuits and all that, you will get it on. How true is this? Or are they just selling things to make people buy a certain
Yeah,
thing?
most testosterone boosters sold online are not very effective or effective at all. So some of the and many of them are not safe. So some of the ones that I see are fenugreek, tribulus, tongat. These are herbs. These are the herbs that you're talking about. A
Right.
few of them may show mild benefits in small studies, but it's not the benefits are not enough to say that it's not a placebo effect. You talked about placebo effect before.
Right.
So the benefits are not more than what you would expect out of a placebo. Worse
Okay.
still is that many of these products are unregulated. Even in the States, in the US, the FDA found out that 20% of online testosterone supplements contained hidden drugs not listed on the label. So remember we talked about the blue pill, right? So somebody will sell this all natural testosterone erectile aid, but they're
Right.
now add some of that blue pill chemical to it. And
Into
so
it.
that's why you're going to get some effect because you actually have a
Ah,
pharmaceutical there, but you're calling it unnatural. In Nigeria, I experienced somebody that was selling a herbal concoction to treat diabetes, and people, I had some patients swear by it and all this. So I actually bought some and had it
okay.
tested. And
Right.
what I found high amounts of was the diabetic, one of the diabetic drugs that I typically use to treat diabetes. The first
Oh
line
my
agent for
word.
treating diabetes is a drug that starts
Metformin.
with an
Oh,
M. And I found
metformin,
a
yeah.
large amounts of that. So
Oh
he
my
was just
goodness.
mixing gin and some herbs and then dropping diabetic medication in there and selling it for diabetes. So, I would never take anything like that. If your testosterone is really low, it's truly low. There are safe ways of medically approved ways of improving your testosterone with either injections, gels.
Right.
I even ordered a roll on for a patient, that testosterone roll on, like you just put it on your armpit, just like you roll on
Okay.
deodorant. And there's so
Right.
many different medically approved that are safe ways of doing it. So if I'm going to advise anybody, I would say definitely don't try it. Be very, very cautious with buying these things, and
Okay.
especially in Nigeria, especially in Nigeria.
I'm not
Don't
even.
gamble with
I'm
your
not.
health
I'm
with a
not going
quick
to
fix from the
touch that.
internet.
Mm,
Hmm?
yes, no quick fixes off of the internet. I know we're plenty that always, oh, we just run and, hey, but it says, hmm. It just seems like the
Just
world
because
is
it
out to
says
get
doesn't
you,
mean
so
it's
be
true.
mindful.
They're under no obligation to tell you the truth. They're just under obligation to sell you a product. So it does, just because it says it doesn't mean that it's true. And
Actually, it's true.
most of them are not okay. I had another patient about 2 3 months ago that took one of these herbs and it worked. He had an
Yeah.
erection that lasted for 4 days. And any erection above 4 hours is called priapism. It's a medical
Yeah.
emergency. I don't know why he waited for 4 days, but by the time I saw him, he still had a very erect penis. There's methods of trying to bring it down. I tried all those methods. I could it didn't work. So I had to do something called a Winter's shunt procedure, where the penis is like this. I had to basically drill holes in the head of the penis, two big holes in the glands or the head of the penis, just so I could evacuate the blood clots. Right. And then later stitched them closed. I stitched them half so things could drain. It was just
Oh,
a mess. That was, it was a two-part surgery over 2 days. And at the end, you're not guaranteed to be able to get erections again. It's not guaranteed that you'll ever have an erection again because a lot of those blood vessels could be damaged. So this these are things that you don't want to even play with. You don't want to play with.
no, that's very scary.
Very
And
scary.
then someone will think that it's okay to experiment on things. Hmm. I I shudder to think what
You're
is
not
life
saving.
is right now, but the
I mean,
things we learn.
I'm telling you real life stories of people that I see right across the table from me. I'm in my office now, right across the table.
Oh,
I hear these stories all the time, and it's a shame. It's a shame.
now that's very worrying. Okay, so now this brings me to a question that I have seen on from three different people. Michael, good evening to you. So Michael says he sleeps during the day. Does that mean he wouldn't be able to get testosterone during the day, since you say it's only produced during nighttime or bedtime?
Oh, okay. No, that's not true. The majority of testosterone is produced during deep sleep. So if you're
Okay,
getting deep sleep during the day, then you're
right,
gonna get testosterone. And testosterone has something, it has two peaks, meaning like you
okay,
have a peak early in the morning, you have a peak
right.
late. So if you're getting deep sleep around that time, you're still gonna have decent testosterone production. The main thing is the quality and the amount of sleep that you're getting. Sleep after drinking a whole bottle of alcohol is not quality sleep.
It's not
That's
quality
passing out,
sleep.
right? And you don't sleep deeply, and your
Right.
body is working on detoxifying your blood, not producing testosterone. So, no, if you get good deep sleep at any time during the day, more than likely you'll be producing testosterone.
Okay. Um, Time's not our friend. So I really quickly need to get into this one. This is another question that I've seen popped up on three different people asking this question, and it has to do with masturbation. So the question basically is, can excessive or prolonged masturbation cause rapid or depletion of testosterone?
Um, No, like the amount masturbation does not directly affect testosterone. Now
Mm,
there is something called excessive masturbation, and it's more of a mental I don't want to say disorder, but more of a mental problem. But I don't know of any studies linking masturbation to testosterone
right.
production.
Okay. So
But
I
that's
hope
a good
that
question. But I'm not telling people to masturbate 20 times a day. There's a problem. That's a problem.
well, you
But
can be helped. The truth is you
yeah,
can be
but
helped.
within reason, there's no issue.
All right. That is good to know. Now let me get back. I have more questions that are popping up, but I think I need to quickly talk about this situation that hmm. And now let's even get into supplements. I've seen most people sell this online and talking about how it works, especially as you grow older in age. Okay, how do these sexual health change? For someone who is in his 20s is, very active, and he can get around as many as he wants, but as soon as he hits middle age, 40s, 50s, somehow into the 60s as well, seems to be different. What could be the cause for this? Does it mean that testosterone has gone completely, or they need to just up take some supplements to make this work?
Yeah, I said testosterone declines slowly from age 30. So from age 30 to age 40, you're probably going to lose about 10% of your testosterone. But from age 40 onward, it falls a little bit faster. So after 40, erections may take longer to achieve, recovery time after sex may increase. And the thing about getting older is not just about the erections, is that your stress in life gets older, gets more. As you get older, you have children, you have work, you have things, so your stress increases, your blood pressure increases,
Oh, yes.
and you
So
have
many things.
other health issues that also start to appear. But the important thing to
Mm,
note is that this doesn't mean your sex life has to end. It just means you have to adapt. And what you could eat and get away with it at age 20, probably not what you can eat and get away with at age 40. And
right.
if you're able to exercise regularly, eat well, sleep properly, you're going to be able to maintain your sexual health longer than the somebody that doesn't do those things. A lot of men in Nigeria don't realize that their blood pressure, their sugar level, um, their stress level, even their prostate health can all affect sexual function. So a simple I recommend men above the age of 40 yearly checkup. Just one yearly checkup with a doctor like me can really do wonders. Really do.
Okay. Okay, and here is the final question I'll have to be able to. Well, I wish I could take everyone's question that keeps popping up. You know what? What I promised to do is share Dr. Ajayi's details so you can reach out to him, ask him personal questions. I know that some of you can ask. You're just, coming through pseudonyms and the likes, but I shall not mention the names any further. What are three simple, I'm limiting this to three now. What are three simple things men can do right now to improve their sexual health?
Number one, exercise regularly.
Okay.
Number one, just 20 to 30 minutes of a day of walking or light cardio boosts testosterone. Even weight training boosts testosterone. So all of those things are great. Number two, fix your sleep. Try and get 7 to 8 hours of sleep, and put your phone on the other side of the room to charge. Turn your tablet off. Turn your TV
Right.
off. All those things make a difference. And the third one would be eat clean. Reduce your sugar, reduce your fried foods, reduce the alcohol, increase vegetables, fruits, lean proteins, and water especially. And you'll see that your sexual health will improve. And one bonus tip is get a checkup, right? Check your blood pressure, check your sugar levels, and you can even check your testosterone levels. And like I always like to say, prevention is easier than treatment. So get a checkup if you feel fine. It's still useful for you to get a checkup, especially from age 40 and up.
Well, I have a sneak question. I know.
Yeah,
I'm,
no
I'm, I'm,
problem.
I'm, it's a sneak one, and I'd like your response in a minute or less. Very quick one. How safe is it for someone to, there's the notion that, and I'm saying this because I've seen it like three people asking the same question, especially when it comes to the amount of hours you're supposed to, um, in a sense, be with a woman or with a partner. So, is it true that you need to have those long extended hours, or is this a notion that has been pushed by what's by social media? Because
Social
with
media,
that, they say, "Oh, you're 1 minute, 2 minute noodles."
social media and pornography have
Right,
distorted what normal sex should be like.
right.
Average sexual encounter between a man and a woman is about 5.7 minutes. That's
Who would have
average.
thought?
If you now survey a bunch, and they've done this survey a bunch of women, most of them would want somewhere between 7 to 10 minutes. So it's not
Mm.
of sexual. So there's ways to get higher in those levels. There's techniques. I don't have enough time to give all those techniques. You can invite me back, or people
Oh,
can call me.
almost,
But
most
but
definitely.
there are multiple techniques so that you can increase your lasting time. But this kind of thing where you're having sexual intercourse for 45 minutes or an hour, all of that is from pornography. Most of those guys, I knew some people back in the States that did porn. They're all using drugs. All of them are using drugs. So and they're using medications and drugs. So all of that stuff is not
Not
natural.
real.
Average is 5.7. Most women want 7 to 10 minutes. So if you can get 10 minutes in there, you're doing very, very well.
That's why you need
And
to,
there's other things besides intercourse, foreplay, afterplay. All
right.
those things are very, very important too. All part of the lovemaking process.
Well, you need to sign up to Dr. Ajayi's clinic, or at least his love uh, health care, and he will share all the tips and tricks. For those of you who would think that, oh, you need to do all so much, well, I shall leave it at that. It's still early hours of radio, so I shall not probe further. But thank you so much, Dr. Abiola Ajayi, for your insights this evening. I know so many people still want to ask questions. However, how can they reach out to you? Your social media handles that makes it easier for them to
I,
get
I
up.
love I love fielding questions. I love answering. Sometimes I get busy, so if you want to do a WhatsApp, you can WhatsApp me directly 0913-579-5108, or all our socials are ROA. That's Robert Oscar Albert ROA Specialist Hospital. We're on Facebook, Instagram, Twitter, TikTok, any one of them, and you can send questions through there, and I'll also get to them. So um I love helping the public. So just ask away. Call me, or I'll give my number one more time: 0913-579-5108, or ROA Specialist Hospital on all the socials.
All right. Thank you so much. Lagos, you know where to find Dr. Abiola Ajayi. Now, if I were you, I'll hurry. But
And
that's the what you can.
if you mentioned that you heard me on radio, or you mentioned Joy, you mentioned Smooth FM, I'll usually do the consultation for free. So just call.
You know how much consultation costs. So if I were you, I'll plug that in real quick. But as always, great to share insights on health with you. And hey, the conversation never stops here. What you can do, like I said, is hurry on quickly over and get all the questions in. But that's how we draw a curtain today on Smooth Health. Thank you so much for your questions. See you on the other side. It's a Thursday, so you know we're going to be throwing back with great music. I appreciate the time.
Another great show. I always have fun when I come on here. I appreciate it.
Thank you so much.
Call me anytime.
I will. I will. Have a pleasant evening.